So I was tested for autism. Y'all are gonna hate this one. But there were a couple symptoms that my ADHD and OCD just weren't explaining. My issues reaching out to people. I always had such fear and trouble initiating social interaction. Feeling awkward, constantly worrying about things, extreme fear to try new food, needing the same routine over and over. And after a month of testing, I was diagnosed with ADHD and OCD. I'm not even nearly on the spectrum, not an ounce on the spectrum. And do you know what I did? I said thank you, and I reflected. Because when a professional does all the testing and tells you what your diagnosis is, or tells you that you are not autistic, that you don't have DID, you believe them, usually. You don't just find another psychiatrist tell you what you want to hear. That's silly. I then had to self-reflect and think, wow, the reason I have trouble reaching out isn't because I'm autistic. It's because I have high anxiety. And since it's not autism, this is something I think I could get better at. I know it is very tempting to say that you have autism without a diagnosis, or say that you have DID, or say that you have some type of mental illness that explains the difficulties that you're having. But the issue is if one, don't listen to the professionals, and two, you use that diagnosis as an excuse to not get better, especially if the diagnosis isn't even true. Remember, just because you have something or you researched something doesn't make you an expert on it, despite TikTok saying otherwise frequently. I hope this helps.